We're here with Deputy Humboldt County Health Officer Dr. Josh Ennis. Thank you for being here with us.
Yes, of course.
We're going to have you talk a little bit about the alert level system, which will be launched this week and measures disease spread, healthcare system capacity, and effectiveness of disease control to gauge the threat of COVID-19 to the local area. What can you tell us about this tool?
Yeah, so this tool has been in development for several weeks, even a couple months at the very beginning. We were starting to look at various sectors related to the response. And from the beginning, we've been saying that looking only exclusively in the hospitals is a far too late place to look, that we really need to know what's happening in the community. And so this has kind of been a culmination of looking at several different things and trying to bring it all together into a single place, both for our benefit to have some structure around what we're tracking, as well as to give the public some idea of what we're looking at and informing where we have areas for concern. And so this alert level system breaks it down into three separate areas. One I think we're all familiar with, and that's disease situation. So there's no shortage of information available online in regards to the spread of disease. And so this is looking at things like how many new cases there are, surveillance systems that look for popping up above normal numbers of disease, such as COVID-19. But it also includes other things in our alert level system that maybe we haven't paid as close attention to because they're further down the line as part of the epidemic. And that's the healthcare system. So do we have critical resources in place, such as the beds, the ventilators, the healthcare workers? We've been saying all along that the healthcare workforce is an absolutely critical piece that we need to maintain to be able to manage a true surge of patients. And then lastly, the third category is disease control. I think everyone's familiar with case investigation, tracing. We try and follow all the contacts of any newly identified case, but looking much more closely at our ability to perform that well and to make sure that we are testing enough people to have a good sense of what's going on in the community and that we're capable of adequately containing the cases that we identify. So we're looking at all three of these categories. We're touching on it on a pretty frequent basis and monitoring the situation. And so we can update the public in near real time based upon some of these things that we're looking at within the department.
And what will change depending on the threat level in terms of how the community will adjust, or how is it going to affect the community?
So I think the idea here is to allow a peek into some of the things that we consider to be important that can ultimately shape policy. And so to make it a little more concrete, there could be decisions made, such as closing another particular sector if there's a concerning trend in some area. It could concern other measures, such as activities surrounding kids in school. We haven't necessarily tied any one of these actions to a particular alert level. And so it's really important to point out that this is a work in progress, much like the dashboard, but it's building upon the dashboard and trying to build much more of a foundation to make decisions that are based in data and that are specific to local conditions on the ground.
And what level are we at currently?
So currently we are at an overall level of alert level of 2. We have color coded it much like a traffic signal. So green is level 1, yellow, orange, red, all the way up to level 4, which is where you find red. We're currently overall level 2, and the overall alert level is determined by the highest level across each of the 3 categories. And so for disease spread, we're currently in level 2 for the healthcare system. And I should note that we're mostly looking at the acute care healthcare system, so that's hospitals. We're currently level 1. And for disease containment or for disease effectiveness of disease control, we're currently level 2. So the overall score is 2.
And what are things that the community can do to keep the level as close to 1 as possible?
Yeah, so I think what's going to be leading here sometimes is that disease spread and control might tick up before we see it end up in the hospitals, affecting that hospital score. It's important to know that we exercise the ability to make this slow down and have more controlled spread. I think what we all fear is uncontrolled spread, or late to recognize that there is rampant spread. And 4 to 6 weeks later, we may have a scenario where we have a lot of people in the hospital because all of a sudden we can't identify, the majority of cases that are actually out there in the community. And so people can exercise some influence over this. What we know is that avoiding bringing separate households together is really paramount for spreading disease. We are seeing a lot more gatherings and a lot more people coming together, and I know we're all so tired of this, but it's becoming clear that new cases may have 30, 40, even upwards of 70 contacts within the infectious period. And so we're kind of in a moment here where it could certainly snowball in the near future. We have dramatically slowed this down. If people are going to assume more risk, we know what works. Avoid going indoors in closed spaces for prolonged periods of time. Wear a mask. Keep your distance from people. And these are all things that keep the entire community safe. We've been really great about avoiding the county monitoring list. I think we've all seen that the majority of the state at this point is on that list. And we have avoided it much to the thanks of community members who are taking this seriously and trying to get back to allowing life to function with some resemblance of normalcy. So I think it's great that our community has done this, and we continue to be able to exercise control over this.
Excellent. Thank you so much.
Yeah, thank you.